Talk News and Sports Station 99.3 Nigeria Info FM. This is the Health and Safety Cafe. My name is Dr. Frederick Unuigbokhai. People who follow me online know me as Dr. Fred Dostar, and I always tell you good life. Nah sense. It's the last Friday of the month, and every last Friday of the month is an open day, question and answer. So you send me your questions, or you can call me, and I pray and I hope that I'll be able to answer you in the shortest time we have. The phone line is 0201 277 0993. The phone lines 0201 277 0993 or 0201 465 7190. That is the phone line 0201 465 7190, and the WhatsApp number is 080 9597 5805 080 9597 5805. So if you have any questions for me that you've been wanting to ask, you can send your questions right now, and I hope and I pray that I'll be able to respond. So we have a call. Let's take no waste time, 30 seconds. Hello, good afternoon.
What's the way to open the show?
Yeah. Please, when you call, turn down the volume of your radio and please just go straight to the point. Less than 30 seconds. No time, eh? Hi, good afternoon. Hello, good afternoon.
Dr. Frederick Unuigbokhai.
Good afternoon.
Good afternoon, sir. How's work?
Very well, we thank God. Your name, where are you calling from?
AY somebody.
Oh, yeah, now talk to me.
Well, I wanted to know, I know you're a medical doctor. I wanted to know what herbal solutions are there for diabetes, if you know any.
Okay. Herbal solutions for diabetes.
Yes, sir.
Yeah, that's what he's asking. Okay. Unfortunately, I don't have, honestly. I don't. I don't, honestly. I'm not trying to discredit anybody. You understand? It's very important I say this. I'm not discrediting anybody, but I don't have. Yeah?
Doctor, have you taken any before?
I haven't.
Even while growing up?
Why?
Before becoming a medical doctor?
Well, the one I know I took was the bitter leaf. They will wash bitter leaf, give me, and a lot like that. And that one, even if you're in your sleep and they put it in your mouth, your eye becomes wide open.
Doctor, at some point in your medical school,
Yes.
did you at any point oppose to, your mom sort of giving you herbal mixture?
See, okay, I wish we can have enough time, and they are listening. We always have some certain type of discussion on certain things, on certain stuffs. So let's leave it at that. Let's leave it at that.
All right.
Hi, good afternoon. Your name and where are you calling from?
Yeah, hi, Dr. Frederick, sir.
Yeah, I greet you, sir.
Okay, my name is Apruchu.
Okay.
Well, in this monthly menstruation on women,
Yes.
it happens this lady sees this thing 2 times in a month.
Yes.
What might be the cause? And it's coming out more than expected.
Okay.
Thank you.
Thank you very much, Mr. Apruchu. It can be normal for some women. What is it?
Yes, I have a question
on this. Okay,
yes.
Okay, quickly. Some women can actually see their period twice in a month, and it is extremely normal for them. So what you have to find out is, what is the length of your menstrual cycle? Most young girls, I'm using the word girls deliberately, I beg, yeah? They don't know. When you ask them, your period, I say, I don't know, just come, I don't. So you need to know the length of your menstrual cycle, and then it will help you understand that, okay, I'm seeing my period twice in a month. It's okay. Some people can see their period once in 2 months and it's still fine, especially if you have 35 days menstrual cycle. So you have to know, first of all, so that we can now say, okay, this is not normal. So I would advise you, if you're listening to me, go to my YouTube. I made a video on menstrual cycle, ovulation, and something about that. The video is about 27 minutes. On Facebook, that video has 600 or 500,000 views. 27 minutes. It's on menstruation. On YouTube, the same. So please go there, watch it. Everything you want to find out is in the video to help you.
So, doctor, on this, I have a neighbor who happens to be close to me.
Yes.
And she's currently going through that. So this month alone, she has seen her period like 3 times.
3 times.
And each time lasts 9 days.
So it's totally
And she
abnormal.
disturbed.
It's abnormal.
With her to a diagnostic center Monday or Tuesday.
To do what?
So she just called me and she told me, she couldn't stand up straight. In the midnight, she woke up and she used the loo, and then the cloth, came out of her body and she was disturbed. So, of course, the next thing is to know what exactly was going on. I suggested hospital. She was, we'll go to a diagnostic center.
Okay.
And she went. And it happened to be a fibroid. Doctor, how possible?
Yes, now. She's having prolonged bleeding. You understand?
She even thought she was pregnant, and then maybe.
Okay. So let me correct something. When you have this type of problem, do not go to any diagnostic center. See a doctor first. I'm not saying the diagnostic center is wrong, is bad. No, see a doctor first. Because if she had seen a doctor, she would have been examined, and they will ask her, when was your last menstrual cycle? Because the abdomen is quite enlarged, thinking she's pregnant, but she's not pregnant.
According to her, she called on a nurse, and then that one told her to go to a diagnostic center. I was concerned because she's close to me, and my child does stay with her sometimes.
So this is the problem again in some of the healthcare system in this part of the world. You are not supposed to do that. I'm saying it on radio. You are first. You are not supposed to just wake up and go to the lab. And then what you hear is, doctor, I went to the lab. They say I have this. What can I take? And you ask them, who sent you? I just went to the lab. I just to test. What do you know you're testing? Now she has fibroid. What if the fibroid is also causing her problems with the kidney? What if she's having anemia because she's now bleeding profusely? She will not even know. This is why it's important you speak with your doctor first. At least have a doctor you can communicate with to guide you. You waste money. You understand? The next thing she will do again now, she will
now go to the doctor. She was going to go to the doctor the next day, according to her.
Okay, so our time is almost up. Let's go to WhatsApp, please. Let's see. God, so many questions. Let me see. Good afternoon, doctor. Why am I having, this is Bade from Surulere. Why am I always having a sharp pain in the eyes after I eat anything that has to do with flakes? Gary flakes and other flakes. I don't want to mention that brand. It's a brand. Sorry, Mr. Bade. So anything that has to do with flakes. Why? So it's I don't know how long this has been happening to you. I really don't know, but there's a very high tendency that you might be reacting to something in this flakes. You might be reacting to something. So the best thing for you to do right now is avoid those flakes. And if you haven't had an eye check for a while, please get it checked. Somebody is talking to me on TikTok. Say, I attend to us on TikTok. Come on, I'm on radio now. I beg, I'm on radio. Well, if you are not following me on social media, please do so. I can guarantee you that you'll be missing a lot. So find me on Facebook, Dr. Fredosta Official. On TikTok, on YouTube, on Instagram, other platforms, Dr. Fredosta. Let me take one more and then I go back to the phone lines. God, the questions on WhatsApp are much. Good afternoon, doctor. My name is Tokbe. Tokbe, good afternoon. Please, what is the cause of hepatitis B? And is it true that it is contagious? And how can one prevent himself or herself from contacting it? Thank you. Tokbe, good afternoon. Hepatitis B is contagious. Yes, much more contagious than even HIV. And what I'm going to tell you on radio is, if you know you have not tested yourself for hepatitis B, why now? You see, when you tell people to get this test, they'll be like, doctor, I better calm down. And then when, God forbid, something happens, you panic. So the first advice I will give to you on radio is get yourself tested for hepatitis B. I have tested myself. I have taken the vaccine, 3 doses. I'm a health worker. I'm at risk of this hepatitis B. So I took the vaccine. So how to prevent? First of all, test yourself. Whether you are a man or woman, get yourself tested. And if you are negative, then take the vaccine. If you are positive, you will most definitely see your doctor. Your question is much. I have videos on hepatitis B. Let's go back to the phone lines. Let's take one more. Hello, good afternoon. Please do call back. Let's see. Hi, good afternoon.
Hello, good afternoon.
Turn down the volume of your radio, please.
I don't know. I have problem in my ear.
Okay.
My ear rings bell.
Oh.
Any medication I take increases it.
Medication?
If I eat food, mostly carbohydrate, it increases it.
Okay.
Night and day, every minute, my ear rings bell.
I want to ask you.
I went to hospital.
Okay. And what?
And I was told they have to wash my ear.
Uh-huh.
So I don't know what to do.
Did they wash the ear for you?
The way the thing is ringing bell, I don't rest, I don't sleep. And if they pour water in my ear, I don't know how it will be. I don't know what I should do.
Okay. Let me advise you. So let me make a comment on that. There are a lot of people that have this noise in the ears. It can be very, very... Okay, no, they shouldn't pour in any water first. Let them check your ears to be sure what is going on and then tell you what to do. I don't have enough time to speak with you. We are out of time. I have a guest joining me very soon. And then when we come back, we'll be going to the second part of the program. But please remember, I don't private chat anybody on social media. I don't give my number for very personal and professional reasons. So I beg, I don't give anybody my number or private chat anybody on social media. I have my very, very personal and professional reasons for that. If you want to speak with me, there is a process for that. Good life. Now, sense. We'll be right back. Don't go anywhere.
.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.